Hi guys, this is my nursing theory lab skills testing, and I will be demonstrating a sterile technique field, wound change, and a CNS swab. I'm going to get started. First I'm going to verify the doctor's order. The doctor's order is daily dry dressing change, cleanse wound with normal saline, swab for CNS, and cover with a 4x4 and secure with tape. Okay? I'm going to wash my hands. Next, I'm going to gather my supplies. And I'm just going to angle this a little bit better here. And I've got my supplies here. I've got my tray, I've got my swab, my hand wash, sanitizer, and normal saline, and I've got my gloves and my tape all ready to go. Next, I'm going to walk into my patient's room. Knock, knock. Good morning, this is Karen. I'm your student practical nurse. The doctor wants me to check and change and collect a swab on your wound. Can you state your name and birthday, please? And I will verify on his armband. Thank you, Mr. Smith. Mr. Smith, this procedure is going to take about 15 minutes. Do you need to use the bathroom? Great. Do you have any known allergies? No pain? No, and with your pain, is it on a 0 scale to 10? With 0 being the least and 10 being the greatest. Slight, okay, 2, okay. And, oh, and you have no allergies, right? Nothing, medication, medical tape, latex? Okay. So I've verified the birth date with 2 identifications, name, and I have asked my patient if he was allergic, and he doesn't have anything, and he's laying comfortably. Okay, I'm going to start my procedure. Okay, I've got the old dressing off. I'm going to assess the wound. I'm going to use that by using the CTEMPS acronym, and that includes the color, the temperature, if there's any edema, swelling, for movement, depending on where the wound was, on what part of his body, and if he was able to move his limbs, and pulse and sensation. Just by looking at the wound, I can see that there's a little pink tone around it. It kind of feels warm as well too. There's a purulent drainage, like a yellowish creamy discharge in there as well. I'm going to discard the old wound, or wound dressing. I'm going to take my gloves off and wash my hands and reapply my gloves. I've got my sterile field here. Within regards to this, we want to make sure that it's not contaminated. We want to check the expiry date. We want to make sure it's not wet. And we want to make sure that there's no holes or if it hasn't been damaged. Okay? I'm going to take package off. Okay. With our sterile field, we want to keep it away from us. So we want to pull it outwards. Okay, and now with the sterile field, there's a 1-inch border around that's not considered sterile. I'm going to toss this away, my tongs, and then being very careful, I'm going to take my little tweezers out, placing them within the 1-inch border. Okay. Now just keep it in mind that with the sterile field, we don't want to reach over it. We want to work at a waist height. We never want to turn our backs, and we don't want to cough or sneeze or anything as well. I've got my normal saline here, which is what I'm going to use to cleanse the wound. And with the importance of with the normal saline is that we want to lip it, which I'll do right now. Okay, and the reason for being that is because if there's any contaminants around the spout where I'm going to pour out of, then we're not going to get that inside of the sterile tray. Okay, there we go. And then I would do my third check on my normal saline bottle just to make sure that's what I'm using, and also check the expiry date too. Okay, grabbing within the 1 inch border. And I'm going to cleanse the wound from inside out. Okay, so 1. Okay. And my second swipe. Okay. And now I'm going to dab it now, dry. Okay, I'm going to dab it again. My wound has been cleansed and now dried. I'm going to take my swab now. And with taking swabs, we want to take from the center of the wound, okay? I'm just going to roll it just enough to get a good sample, okay? Place it in the tube that it comes with. Always put it back and keep it in the biohazard bag. With the biohazard bag and with the swab, we want to make sure that we have the documentation with it, and it all depends on the facility where you're working. You could be able to take this down to the laboratory yourself. If not, then take it to the designated place where it's supposed to be picked up. Now the doctor wants me to redress the wound, and with the 4x4 gauze. Okay, there we go. And I'm going to tape it. And after we're done dressing it, we always want to make sure that we want to put our initials and the date. And this only lets the next nurse on duty, or whoever the next nurse is going to be later on in that shift, know when that dressing was last changed. Okay, now I'm going to clean up my area. And I would discard this. Take my gloves off. Hand wash. Cover up my patient here. We want to keep them comfortable still. Now that I am done my procedure, I would lower the bed to make sure that Mr. Smith was left comfortably in a comfortable state, and also for safety purposes as well too. Now, once I leave the room, I'm going to go and chart, and I would chart on the wound and what I did and what I had witnessed. Thank you. That's it for my video.